Hi everyone, Nigel here from Phoenix Rehab Physio and Hand, and today I want to share with you a common condition that our hand occupational therapists or hand therapists treat, which is called carpal tunnel syndrome. And most of the patients usually tell us this story, right? They will tell us that they wake up at 2 o'clock, 3 o'clock, 4 o'clock in the morning. What happens is that their hands, especially these 3 fingers, right? It's very numb, it's tingling, even their palms is a bit tingling as well. And then they do their usual, right? They kind of shake it, try to shake it off kind of thing. And then it settles a bit. And then because of fatigue, of tiredness, then it settles just a bit, and then they go back to sleep. And many of them, they've probably been doing that for months. Rule of thumb, as I've experienced as a hand therapist, is that they've been doing that for minimum of 6 months to 2 years, sometimes even longer than that. And they always tell themselves the same thing, it's nothing, it's just aircon's too cold, they have bad posture, bad sleeping position, or maybe they're just tired, or maybe their spouse or their pillow kept the hand in a weird way, or poor circulation. And let me tell you the truth, right? So every night when that happens, the nerve inside your wrist, right, is being strangulated, it's being strangled, compressed. That nerve compression, when it happens, when it happens, right, again and again, over nights, weeks, months, and even years, will cause damage that gets harder and harder to fully reverse. I mean, if you think about it, right, if you take a plant, just to give an example of a plant, if you choke the plant, like I have a plant that recently died because there was a wire that choked it that I didn't realize it was a wire, right? It choked it, and after 3 months, 1 plant died because that wire choked it, right? So likewise, in your wrist, there's a nerve called a median nerve, and this nerve is surrounded by many other structures. I think 7, 8, 9 structures, right? And then these structures can squeeze it. So like what my example of the plant, sustained, repeated nerve compression, nerve strangulation over weeks, months, years can cause permanent nerve damage that gets harder and harder to fully reverse. Yeah, so in this video, I'm going to show you what's happening inside your wrist while you sleep, while you use your hand, okay? And other common symptoms like, you grip stuff and stuff drop, or you feel as though your muscle in your thumb over here kind of shrinking, kind of weakening, right? What stage of carpal tunnel you're at right now, and why the window to fix your carpal tunnel syndrome is not very as big as people think, right? So let's talk about what's happening. So your wrist has a tunnel running through it. I'm going to put image in a while, right? Your wrist has a tunnel running through it. It's a very narrow tunnel, super narrow tunnel, okay, formed by your wrist bones on 3 sides. And it has a thick ligament on top somewhat to cover it, right? This tunnel that all the stuff goes through is called the carpal tunnel. And running through it is the median nerve. And this nerve is responsible for the feeling of your three fingers, thumb, index finger, middle finger, and the long half of your ring finger, right? So when you sleep, or when most people sleep, right, they naturally, their wrists will bend either forward or backward, right? Even a slight bend significantly narrows that tunnel inside their wrist. And when that tunnel narrows, the nerve inside gets strangled, gets compressed. So that's the mechanism, right? So that's why tingling typically happens for people with carpal tunnel syndrome at night. And that's why shaking your hands gives you temporary relief, because you're momentarily changing the pressure on your carpal tunnel, the nerve, that allows the blood flow to return. But the compression is still there, okay? The anatomy hasn't changed. Nothing has been fixed, right? So the biggest mistake I see that people using that morning relief or the shaking relief, that is not serious. They think that, oh, shake, okay, really, that means not serious lah, right? Shaking out is not a sign that it's minor. It's a sign that the nerve is still responding, is still responsive. This is a key point, right? There will be a time when it's too late, the nerve and the muscle will not respond, and we don't want to get there. Okay, that responsiveness is exactly what we are trying to protect. Okay, there's 3 stages. Let's talk about next section. There's 3 stages of carpal tunnel syndrome. So carpal tunnel syndrome progresses through 3 stages, right? 3 stages. So understanding which stage you're in right now is the most important thing that you can do today, because the treatment options and the likely outcomes are very different for carpal tunnel at stage 1 versus stage 2 versus stage 3. So carpal tunnel syndrome at stage 1, right, the symptoms are on and off. The tingling and numbness happens mainly at night. Sometimes when you're intensely holding a phone, or when you're driving, you're gripping too hard, you know, or when you're carrying your kid or playing your dog. So when it only comes on sporadically, right? Shaking out the nerve and the compression works very reliably. Okay, you might have no daytime symptoms at all, and this is a stage where hand therapy alone is the best time to come in. Hand therapy by itself, without carpal tunnel surgery release, is very effective, and you are least likely to need anything more than that, right? This is where at stage 1 the median nerve is under stress, under strangulation, but it has not sustained significant damage. Okay, stage 1. Stage 2, okay, carpal tunnel syndrome stage 2 is where the symptoms start appearing throughout the day. You will notice, tingling in your hand, weakness in your grip throughout the day. You start to miss things or drop things occasionally. It could be your wallet, your phone, your pen, your cup. Fine tasks like, writing, picking up coins. It's a bit more harder than usual, but you're like, hard, not hard, but you're noticing it, right? Buttoning a shirt is tough, doing up a zip, undergarments, socks. Typing for long periods also can cause that tingling and numbness to come. So the nerve at this stage 2 is now under enough prolonged and repeated strangulation and stress that the nerve function is starting to be affected during normal daily activities, not just at night. So stage 1 is mainly at night where you feel it more. Stage 2 is in the daytime, that's as you do your stuff, and at night time, that's stage 2, right? At stage 3, and this is a stage where I don't want anybody to have, in fact, I don't want you to have even a stage 2. So stage 1, it's best that you treat it with hand therapy and be done with it. But in some cases, patient didn't feel it, something happened. Okay, carpal tunnel syndrome stage 3. This is where delay can become semi-permanent or permanent. The muscle at your base of your thumb over here, this is called a tena eminence, this drumstick of a muscle, okay, it's called tena eminence, begins to waste. Waste means not like it's just rot away, it shrinks, okay? And you cannot just see it, you will feel the weakness, and patients will show you, you can see left and right hand, one side is more plump muscles, more firm muscles, and where the other side is flatter. You can tell even on the dominant hand, right? The fullness of the muscles just flattens and shrinks. Grip strength drops measurably, significantly. You will know. You will fumble with your keys, you will fumble with your phone because there's no strength to sustain the grip, right? Numbness is not sporadic. Numbness not just some daytime, some nighttime. Numbness becomes permanent. Right now it's constant, no longer intermittent. And the critical clinical reality at stage 3 is this: I will be very kanjong even at stage 2. Okay, kanjong means to be very anxious, to be very worried. Stage 3, even when your underlying compression is relief, even after treatment, even if you rush to do surgery, to do a carpal tunnel release surgery, the nerve damage might have already been done and may not be reversible. The nerve strangulation can stop getting worse, but what has been damaged, what has been lost, might not always be recoverable. And that's why sometimes I speak such intensity or such seriousness. It's not that I don't have fun when I share about this kind of thing. I'm always worried as a therapist. So these are 3 stages of carpal tunnel syndrome patients we see in our clinic in Phoenix Rehab. Okay, some have been living with night symptoms for 2 or 3 years. They waited because daytime symptoms were not bad enough, or because they thought that surgery would fix everything when they decide to have surgery. Okay, so the purpose of this video is to reach you before you hit stage 3, ideally before you hit stage 2 also lah, you know. So let's talk about the 3 big mistakes that people with carpal tunnel syndrome have. So mistake number 1, people often say, oh, it's poor blood circulation, poor circulation. This is the number 1 thing that patients say. My hand just fall asleep. I've always had poor circulation. So circulation and nerve compression are 2 different things, 2 different worlds. Poor circulation will affect the entire hand, okay? But carpal tunnel syndrome is very specific. It follows the exact distribution of the median nerve that supplies, remember I told you just now, that supplies the feeling for your and movement for your thumb, index finger, middle finger and long half of your ring finger, right? This selective pattern or this particular pattern is not got nothing to do with circulation. So sometimes people say, oh, I got no diabetes so I got no problem. No. It's 2 different problems. But so if you have this very specific pattern, you are actually looking at median nerve compression at your wrist level, right? Yeah, you should assume that unless proven otherwise with seeing a doctor and therapist. And that's mistake number 1. Mistake number 2 for carpal tunnel syndrome is that they assume that it's okay to just rest. You treat it with rest, okay liao, hosei liao. Okay, so rest is good, okay? Too much stress is not good, by the way. Rest is good, too much stress is not good. However, with nerve compression, rest is not a sufficient treatment. Okay, rest is not a sufficient treatment for nerve compression. So you must remember I said the tunnel inside your wrist here is structurally, is mechanically narrow. Your median nerve is being strangled, okay, by the shape of your own wrist anatomy. So there's bones surrounding that tunnel, there is tendons surrounding that nerve. So if there's swelling, if there's a lot of use, or if there's a damage, it actually just squeezes the softest structure in that tunnel, which is your nerve. Tendons are pretty hardy, although it can get damaged as well, but nerves will get strangled by everything else that's harder than it. So resting your hand from typing or from activity might reduce the inflammation slightly if that's the one causing the swelling, right? It might give you temporary relief, but it does not change the diameter of this carpal tunnel. Okay, the compression, the strangulation of your median nerve in your carpal tunnel continues, and your nerve continues to sustain low-grade damage over time. It's like a slow strangulation, and your nerve, your median nerve in your wrist, when you feel this tingling and numbness and dropping of stuff, that's your median nerve screaming for air. Okay, so when it still can scream, it's still not bad. We can still faster treat it. The moment it cannot scream, that's why you see all the terrible things of muscle shrinking, no feeling, dropping significantly, or cannot even pick up stuff very well. Okay, rest manages symptoms but does not treat the cause of carpal tunnel. Right. So the third big mistake that patients with carpal tunnel always have is that they assume that the problem can always be fixed later. Okay, I need to address this. This is particularly frustrating because it's the assumption that many people come to Phoenix Rehab clinics, right, that cause them to be in a worse state than they needed to be. Okay, a lot of patients know that, oh, something is wrong. Okay, they're known for a few weeks, a few months, maybe a year or 2. It's kind of late. Okay, and they're waiting for it to get bad enough to justify taking action or doing something about it. Okay, so the assumption is their assumption, which is really, I mean, I can understand because of the eyes on track, right? I understand, but the assumption is this: the bad assumption, the wrong assumption is that, oh, I can always get it sorted when it becomes a real problem. Okay, that is true only to a certain point for mild cases. Okay, but once nerve damage, okay, reaches a certain threshold, the recovery ceiling no longer is very high; it just drops. Okay, regardless of what treatment you receive, it's drop is drop, okay? You want to act while the symptom is mild, while the recovery ceiling is high. The problem is that when the symptom is mild, patient think it's mild. Then they were like, too mild, no need to treat it. But conversely, the ironic thing is that when you treat things when they are mild, you will get the best recovery. Instead of waiting for it to degrade further, getting worse, then treating it, then justifying for action, then I understand, like, it's human nature, right? We're also busy, you know, so I get it, but just have a think about it. Don't let things fester or worsen. If you can nip it in the bud before it becomes a full-blown big problem that's irreversible, think about it, okay? Yeah, I don't want to be a doomsday kind of therapist, but where it's urgent and important, where it cannot be reversed, I think this seriousness is required lah. So you want to act while the recovery ceiling is high and when the symptom is mild. That means acting when it's still carpal tunnel stage 1 or stage 2, not when the muscle is already visibly wasting or significantly wasted away, right? So let's talk about hand therapy and what comes after when you decide to come in, right? So what does the right treatment path really looks like? For stage 1 and early stage 2, hand therapy is the first and foremost complete answer. Okay, as a hand occupational therapist, here's what I do with my patients at this stage. First of all, splinting. We gotta customize the splint for you that holds your wrist in a neutral position during your sleep. Because sometimes we sleep this way, we sleep this way, we sleep whatever way because we're sleeping, right? But we want the customized thermoplastic splint to keep your wrist in a resting position. Okay, it's called POSI, position of safe immobilization or best healing position. Okay, neutral means that the tunnel stays at its widest all through the night or as long as possible, all through the day, so if I can help it. When we put it in this position or put it in this splint, your nerve is no longer compressed during the days when you wear it, compared to the days where you're not wearing it and your nerve is being compressed in your wrist. This alone, right, can significantly reduce night symptoms. Although some patients like, magic ah? Well, I want to call it magic, but it's really biomechanics, it's really physics and biology. You gotta position it well to rest. Okay, it can significantly reduce night symptoms within 2 or 3 weeks, right? Generic pharmacy splint are not adequate because they are generic size, generic shape, and many of them they buy wrongly, then it doesn't support well in the splint itself. You gotta have a customized one done by Phoenix Rehab. Angle matters, fit matters, and a badly positioned splint worn for months may get you worse, right? Number 1. Number 2, we'll do nerve gliding exercises. So your median nerve can become tethered by inflammation, you stuck, right? And restricted in how it moves through, glides through the tunnel. There are specific nerve gliding movements that help to restore this nerve gliding mobility and reduce the mechanical strangulation and stress on this carpal tunnel on your median nerve during your daily activities. These are not generic wrist stretches, they are precise exercises, precise nerve gliding for your median nerve in your wrist. Thirdly, load management. We look at how you're using your hands throughout the day, your grip patterns, your wrist positions at your workstation, your hold, how you sleep, what activities are loading the tunnel the most, and how you can modify them. I know we work quite a lot and there's a lot of responsibilities, but you gotta find a way to fit your work to you and make some changes so that it's more sustainable for your body and your wrist. Okay, here's the key question. When hand therapy alone is not enough, or when somebody presents at stage 2 coming stage 3, surgery is the right next step. I know people don't like the idea of surgery, hospitalization, but if it's urgent enough, I will even tell my mother or myself, I will go for it. Carpal tunnel release surgery is a very established procedure. The surgeon cuts. Remember, I said there's a cover in the tunnel. So the surgeon just releases that cover. It's called a transverse carpal ligament to permanently widen the tunnel and decompress the nerve immediately. Okay, there's almost very little risk because very little blood source in that cover is the ligamental cover. Okay, recovery is generally very straightforward. Most people are back to light activity within a few weeks. So what patients are most often surprised to learn is that post-operative hand therapy is not optional. That means it's required. The procedure revolves structural compression and decompression, but nerve recovery, scar management, grip rebuilding, the desensitization, the use of your hands proper, that happens through consistent hand therapy after carpal tunnel release. Patients who skip post-surgery hand therapy or physiotherapy usually takes a very long time to return to full function, and some they have permanent limitation that could have been avoided, okay, because they're just not addressed or didn't think about it. Alright, so if you're not sure what stage you're at, that's exactly what a hand therapy assessment is for, which our hand therapist will do. Once you come in, we'll tell you clearly exactly where you are, what you need, what your wrist needs, right? And whether this can be resolved conservatively without surgery, or whether you need a referral to a hand surgeon or orthopedic surgeon. So you can just WhatsApp me or just comment down below, and I'll be happy to connect you to my hand surgeons and orthopedic surgeons, okay? I don't get commission on. It's really value add to share, to help, because I just want you to get better, okay? So, the point that changes everything is that, hear me out, okay? I want to be honest with you. There is clinical threshold in carpal tunnel syndrome where the damage becomes irreversible. It's not just carpal tunnel. Many of other parts of our body, there's always a threshold. Okay, but in this particular video, I'm going to talk about carpal tunnel syndrome. It applies to every other part of your body, right? So when your thumb muscles, the thenar muscles, waste visibly, we can't reverse it. I can help you train as much strength as possible, but when a muscle has gone from 100% and dropped to 30% in size permanently, it's not something that we can reverse easily, okay? Right? But I can really work it as much as you can for you. When the nerve has compressed for long enough that the nerve fibers themselves has permanently changed structure, you may have numbness forever, right? Nerve heals slowly, so hopefully that will go away. But if the nerve has been so damaged, you might not be able to undo that, right? So where sensation and strength can improve after treatment, but not fully. So I've sat across many patients, hundreds if not more, and patients know that something was wrong for 12 months, 18 months, 2 years, 3 years. They felt the tingling, they have the night symptoms, they dropped stuff, but they were busy and they just kept hoping that it would settle on its own, and they kept popping painkillers to take away the discomfort, the swelling. So I'm not telling you this to frighten you, okay, a bit, okay? Just for you to take action to take care of yourself. I'm telling you this because if you are waking up with numb hands at night, you are not at that point yet. You are at a point where the outcome is still determined by what you do next. Okay, so the median nerve is being compressed while you sleep, can still fully recover. Okay, but that window of recovery is not unlimited, it's not indefinite. Every month of continued strangulation of the nerve without treatment is a month the nerve keeps getting damaged that it didn't need to get damaged at all. Right? So if that's you, please, or you know someone who complains about nerve tingling in their hands, please arrange for hand therapy assessment, treatment at Phoenix Lab Physio and Hand. Let's get it sorted out for you, right? So here's what to do this week. When you sleep, notice which fingers go numb. If it's your thumb, index, middle finger, and bit of your ring finger, that's likely median nerve, which is likely carpal tunnel. It matters. Notice whether shaking your hands gives relief. If it gives relief, that's consistent with stage 1 or stage 2 of carpal tunnel syndrome, nerve compression. Okay, at this stage, hand therapy is most effective and outcome is still best. Okay, make an appointment, book an assessment with us. Not 6 months, not next year, this week, please, or next week at worst. Okay, a hand therapy clinical assessment will tell you exactly what stage you're at, whether you need custom splinting and hand therapy, whether you should see a hand surgeon, and what the realistic recovery timeline looks like your specific situation. Especially if your tingling has been more than 2 weeks, you just come in, don't wait anymore. That's why I tell everybody, things that will resolve on its own typically resolves itself by within 10 days to at most 14 days. If it's been there beyond 10-14 days, come in ready.